Hello everybody. Now I am presenting a new video based on MCQs in pathology for second M.B.B.S students. Now this is from General Pathology Set 1. I am doing this because so many of the students requested to do videos on the general pathology. This is for second M.B.B.S, and for the MCQs there is a stem or the question, and there are four options, and you have to choose the best response type of a choice out of the four options or distractors given. Please note that one answer is correct. However, I would advise you to just check the answers of other distractors so that the questions can be restructured by some other person giving emphasis to the other point. Now my references are the books that are commonly used by the undergraduate students: Robbins, Harshmohan and Ramdas Naik. Now let us see the first MCQ. Programmed cell death is known as, the options are A. Autolysis, B. Cytolysis, C. Apoptosis and D. Necrosis. C. Apoptosis is the correct answer. As you know, apoptosis refers to programmed cell death that occurs in multicellular organism. The next one is activation of apoptosis occurs due to, the options are caspases, elastases, endonucleases, ribosomes. I would advise you to, after seeing this, you write on your rough paper and judge your own status of the knowledge. The correct answer is caspases. Now, the caspases are a family of proteases, enzymes that execute programmed cell death, that is apoptosis. Which one of the following is an example of apoptosis? A. Negri body, B. Councilman body, C. Russell body, D. Gamma-Gandy body. Councilman body is the correct answer. Now the Councilman body is an apoptotic body seen as eosinophilic globule in hepatocytes of viral hepatitis. So apoptosis can be pathological as well as in physiological format. Now this is an example of pathological apoptosis in viral hepatitis. Autophagy is the process in which cell undergoes programmed cell death, cell eats its own contents, cell engulfs foreign substance in the cytoplasm, cell nucleus shows fragmentation. The correct answer is B. The cell eats its own contents, that is autophagy. Autophagy, the word is derived from auto means self and phagy means eating. The self eats its own the catabolic substances. Is the catabolic mechanism in which the cell degrades its own dysfunctional or worn out parts by way of cannibalism. A 46-year-old male died due to acute myocardial infarction or MI. After post-mortem, histopathological examination will show which type of necrosis. Now in your structured format, they may give some details about ECG and chest pain, etc. The clinical scenario based stem of the MCQ, but the options remain the same. The necrosis type in myocardial infarction is A. Coagulative, B. Caseous, C. Liquefactive, D. Fat necrosis. The correct answer is coagulative necrosis. Coagulative necrosis results due to sudden arrest of blood supply, causing irreversible cell injury. It retains the outline of the cell. It is seen in the infarcts of the heart and also in the infarcts of the spleen and kidneys. Infarct of brain is associated with coagulative necrosis, fat necrosis, liquefactive necrosis. I'm sorry, fat necrosis is again repeated. So you can take it as a fibrinoid necrosis. See, liquefactive necrosis is the correct answer. In this liquefactive necrosis, the damaged tissue is converted into viscous fluid and is commonly encountered in brain. So, liquefactive necrosis, cerebral or brain infarct. Type of necrosis in acute pancreatitis is A. Fibrinoid necrosis, B. Fat necrosis, C. Caseous necrosis or coagulative necrosis. The B is correct answer. What happens in acute pancreatitis is the pancreatic enzymes are released, and most important are the lipases, which are destructive, and then they cause the fat necrosis. Lipases destroy the fat. Next, diabetic foot is an example of. Options are dry gangrene, necroptosis, apoptosis, wet gangrene. So you have to conversant with all these terms. Now in this case, the answer is wet gangrene is correct. Now in diabetes mellitus, there is high content of glucose which favors the growth of bacteria, and therefore it becomes a wet gangrene. Which of the following is true about apoptosis except chromosomal aberration, condensation of chromatin, inflammatory response seen, cell shrinkage? C, that is inflammatory response seen, is the correct answer. Oh, I'm sorry. Inflammatory response is not seen in apoptosis as against the necrosis. In contrast to necrosis, there is no inflammatory response in apoptosis. So this should be no inflammatory response seen in the case of apoptosis. Please correct. So this is if we take either, but if this is the structured as which of the following is true about apoptosis except means this one, no inflammatory response. Have you got it? So if we say only this much, but if you add except, so you have to read the stem of the MCQ very carefully, and when it is except, it is like this. Please note this. Which of the following is an example of reversible cell injury? Coagulative necrosis, fat necrosis, apoptosis, and cloudy change. D is the correct answer. Cloudy change or hydropic change is entirely a reversible change and commonly seen in tubular epithelium of the kidney. Like cloudy change, fatty change of the liver is also an example of reversible injury. You are requested to subscribe to my channel. You have to just type Dr. Sanjay Deshmukh Pathology and then press the bell icon so that you get subsequent videos. Please like the video and offer your comments. I would request specifically your comments on this MCQ type of videos. If you like them and I get good response, I will post more such videos in near future. Brown atrophy of heart is due to accumulation of bilirubin, lipofuscin, hemosiderin, hemozoin. B, that is lipofuscin, is the correct answer. Lipofuscin or lipochrome is a wear and tear pigment found in aged atrophic cells. In heart, it is seen as golden yellow pigmented granules around the nucleus of myofibers. Pigment seen in malaria is hemosiderin, hemozoin, bilirubin, hemoglobin. B is the correct answer. Hemozoin or hematine is called malarial pigment. It is hemoprotein formed from brownish black pigment containing heme iron and ferric form. Metastatic calcification is seen in the following except. Now be careful about this except. Hyperparathyroidism, milk alkali syndrome, hypervitaminosis and atherosclerosis. Now the correct answer is D. So in atherosclerosis you see dystrophic calcification. Now atherosclerosis is an example of dystrophic calcification. Metastatic calcification refers to deposition of calcium salts in otherwise normal tissue. The serum calcium levels are elevated, which can occur because of the deranged metabolism or increased absorption or decreased excretion of calcium as occurs in hyperparathyroidism because of parathormone levels. The classic Klinefelter syndrome is associated with which of the following karyotype? A. 45X, B. Trisomy 21, C. 47XXY, D. 46X. What is the correct answer? The correct answer is C. 47XXY. Now the Klinefelter syndrome 47XXY is cytogenetic disorder of sex chromosomes. As you know, there are sex chromosomal abnormalities and somatic chromosome abnormalities. There are 2 or more X chromosomes and 1 Y chromosome. Another important thing in this is the question may also be twisted and asked upon on trisomy 21, which refers to Down syndrome. So these are the two important syndromes on which the MCQ can be asked, or even short questions can be asked in theory paper. A hockey player student sustained blunt injury on his leg. The area after 2 weeks showed brownish black discoloration. Which of the pigment is most likely responsible for the discoloration of the patch of blunt injury? Lipofuscin, hemosiderin, bilirubin, melanin are the options. The correct answer is B, hemosiderin. The blunt trauma leads to subcutaneous hemorrhages. Iron and heme from the RBCs get converted to hemosiderin, causing color change, which may after blunt trauma or after the bruising. So this is important. a structured or clinical scenario based MCQ. Thank you very much, and I hope your response and comments on the MCQ videos. Thank you very much.